Good morning, everyone. Good morning. Yay. Welcome to Greenfield, Massachusetts. We're delighted to have you all here today. We're going to go ahead and get started. My name is Katie Volk, and I'm with the New England Mental Health Technology Transfer Center, MHTTC. We're going to talk to you more in depth about what that is in a few minutes. But I just wanted to welcome you all. I work closely with the whole team here, and I know I've spoken with many of you on the phone, and we're really happy that everyone has been able to make it here today. This symposium represents what I hope is the start of many conversations to come. This is really the beginning of a conversation today. And over the course of the day, we're going to have an opportunity to hear from many people, both in a formal way, and my hope is that informally you all have an opportunity to talk with one another, because during our day-to-day work so many times we don't get the chance to do that and reflect. The other thing I wanted to say is that this is a really personal topic for many of us. There's a lot of passion, certainly heartache and grief, and also a lot of resilience. And so as we're going through our conversations today, take time for yourself, take a breath, take a walk in this beautiful space, find a friend, find a colleague if you need it, but just do what you need to do to take care of yourself as we're trudging through and listening to stories and really thinking about what we can do to make sure that we are doing everything we can to prevent suicide in New England. So I am going to turn it over to my colleague Maria Restrepo-Toro to give a little overview of New England MHTTC.
Well, good morning, everybody, and welcome. My name is Maria Restrepo-Toro, and I'm an educator at the Yale Program for Recovery and Community Health, and I'm also the manager of the Mental Health TTC, and I'm going to talk to you as a handful of letters behind. So first, I want to say that this is an effort of colleagues, and whom they're all two of us are here today. Our team is the Yale Program for Recovery and Community Health, and we have the director of the community mental health, which is Dr. Larry Davidson, and we also have Graciela Reese, who is also a member of the Mental Health TTC. We are doing this effort in partnership with C Innovations. Please, my colleagues, Katie, Livia, and many others, and Vanessa, and the camera crew is also here. And we're also partnering with the Harvard University Department of Psychiatry. So what is Mental Health TTC? Let me tell you why this exists. We are just starting this process. We are almost completing year one. This is one of the 10 centers around the country. This is a grant that was put out by SAMHSA, and they have been doing this kind of work with these technology transfer centers. It started with the addictions field. So the ATTC, if you have been familiar, have been going around, been in existence for a long time in Rhode Island, actually, out of Brown University. So this year, they just started to do the mental health technology transfer centers. There's 10 centers around the country, and we are all sharing the same vision, which is really to use evidence-based practices to use dissemination, training, and technical assistance to do that. So our scope of work is really larger. Suicide is just one aspect of this work, but we have an entire mission. For New England, and in your packet, you're going to see you have the principles, the guiding principles of our Mental Health TTC of New England. So our mission is to use evidence-based means to disseminate evidence-based practices across the entire region. This is why we're meeting here today. Centrally, what we hope is a centrally location area for everybody within New England. And for our Mental Health TTC, which is Region 1, as it is determined on the HHS classification of centers, we have a unique expertise and want to be working with everybody here and across New England in recovery-oriented practices that includes peer support within the context of recovery-oriented systems of care. So our hope for today, and I want to echo what my colleague Kate has said, is we're here to have the first conversation. I want to make sure that everybody in this room understand we're here. This is the first conversation to take place on this topic. We have been trying, we started, I'm going to talk a little bit about the process, how we got here in a second. But we're here, the mission of this center is to convene everybody and to learn from each other, to learn cross-work from Maine to Vermont to Connecticut, and together come up to what will be the best way that the New England Mental Health Technology Transfer Center could support those activities and the great work that all of you are already doing. So we're here to convene, and we're inviting you to come with, we are here to hear what you have to say to us. One of the big things we're going to be doing this for the next 5 years or the next 4 years at this point is we are really ensuring inclusion. There's wonderful initiatives across the New England, but there is a great amount of underserved communities that are not receiving either appropriate access to care or even access in the language that they want to get their services for. So the goal of the Mental Health TTC is to ensure that any kind of training we do, and you will see we do lots of things, all free events that we invite you to join and participate from, is to ensure that we are actively and responsively maintain a network of people. This is where all of you represent here. We are doing our best to really reach out to every stakeholder in the New England area. Of course, we're missing some people who are just getting off the ground. But we want to invite community, providers, researchers, youth, family members, people in recovery, everybody from the 6 states in the country. So the way we started to do our work is we started doing this with assessing the regional needs of the region, and we conducted a variety of interviews throughout the New England region with all variety of stakeholders. You're welcome to see those results. Based on that, we have identified that the true priorities for this year have been the programs around first episode psychosis and suicide prevention in New England. That is setting our priorities. Therefore, we go in with those priorities in mind to develop and disseminate those kinds of topics that are going to be really serving your needs. Again, this center is not here to duplicate what's already on the way. We are here to convene and support existing practices and being able to connect with each other, like a practice in Vermont may inform the practice in Connecticut or vice versa. So we are here to kind of monitor, respond to inquiries and assist you in that process. And clearly, of course, we have to do a big evaluation, which we, will probably send you a link as a part of our survey. So as I said, because our mission as a mental health TTC, one of the 10 missions in New England is to help accessing consultation and technical assistance. We're providing this in 3 levels. If you see that graphic, you see in the top of the pyramid is the universal technical assistant. That's kind of like mailings, newsletters, kinds of communications that we will produce that are not necessarily designed to change behaviors or train people in skills. Then we do a little bit more of targeted technical assistance. Those are our learning collaboratives, which we already have some on the way. That we'll talk about probably at the end. And then we also seek to provide more intense technical assistance with each of the 6 New England states. And that's when the stakeholders like yourselves are critical in this process, because then we can help you connect one person here with one other person. So our intent is to all work together to achieve this kind of a mission that we're all very invested. And again, we are really seeking to create that all the access and resources, and that's going to be definitely one of the areas we're going to have a conversation today, is the work you're doing culturally and linguistic appropriate? Because that's a huge area of need, and there's a lot of people that are left behind because they don't have those access or is not provided in that way. We have a great school a school supplement of mental health, and we're going to have that for 2 years. This is out of this grant came a supplement grant to concentrate solely on school mental health, and what they have been doing is there's a learning collaborative with fellows, 2 fellows per state working in a school to create childhood trauma informed school settings, child center, and is going absolutely fabulous, and we could definitely connect you with our fellows who are working in the different states. So that's just for you to be aware that the mental health TTC also have a school mental health supplement. So as a sample, and I'm just going to finish, is just to show you things we're doing currently. We're doing a learning collaborative led by our colleagues at Harvard, Early Psychosis Learning Collaborative. We're doing trauma informed with another mental health TTC. We're doing newsletters. We're doing products. For example, they did a school and work coaching for youth. We do networking events. Not only we do that, but we attend. Katie and I and others attend a couple of those. So if you do have a state event or any kind of event in your community that you want us to come and present and introduce, or just people to meet who we love to come and visit your community. And this is just a kind of webinars that will happen. What will happen with this today is they're here to determine, we're here to decide what will be the best first step for us to do in a learning collaborative. If it's a learning collaborative, what is it? We don't know. It's going to be up to this group today. So for the mental health TTC, you have in the packet welcome inquiries, and of course we're here as well. We are happy to give us your email, but all the kind of communication is handled through C4, but clearly you can contact any of us at any time. Thank you.